Well, at a time like this, it would be nice to have an effective World Health Organization, one led by serious, capable professionals. That might be invaluable for beating coronavirus, or at least containing it. But we don't have that. Instead, the WHO is a corrupt mess from top to bottom. The current Director General of the World Health Organization is a man called Tedros Adhanom Ghebreyesus. He was previously the health minister of Ethiopia. Now, politically, Tedros was a member of the Tigray People's Liberation Front. That's a Marxist-Leninist Ethiopian political party. It's part of the coalition ruling Ethiopia as a repressive authoritarian state. After taking control of the World Health Organization, Tedros promptly tried to appoint Robert Mugabe, the murderous dictator of Zimbabwe, as an international goodwill ambassador for public health, if you can believe that. Tedros delivered a speech praising Zimbabwe as, quote, a country that places universal health coverage and health promotion at the center of its policies to provide health care to all, end quote. Now, that's lunatic. But bad politics aside, Tedros has endangered human lives, which is a weird resume point for a man running a World Health Organization. As health minister in Ethiopia, on 3 separate occasions, Tedros covered up cholera outbreaks in the south of the country. To downplay the outbreaks and protect Ethiopia's reputation, Tedros each time insisted that they were simply rashes of, quote, acute watery diarrhea. According to media reports, Ethiopian officials pressured aid agencies to cover up the truth about what was happening and hide the number of people affected. As soon as the disease spread to neighboring countries, it was obvious that it was cholera and identified as such. If Tedros had told the truth at the time, which he did not, lives could have been saved. This is the man running the World Health Organization at the beginnings of a global epidemic. When the coronavirus first broke out in China, China refused to admit international health experts into their country to assess it. To this day, it seems likely that China is lying about the number of infections and the number of deaths. Yet despite this, Tedros has publicly praised the Communist Chinese Party for, quote, transparency. The whole thing is Orwellian. And by the way, your tax dollars are paying for it. The U.S. gives hundreds of millions of dollars a year to the WHO. It amounts to a huge percentage of their budget. So how do they spend the money? Well, every year, about $200 million of the World Health Organization budget goes to travel for its bureaucrats and staff. They often fly business class, sometimes using fraudulent pretexts to do so when it's otherwise forbidden. Other aid agencies, respectable ones like Doctors Without Borders or our own CDC, ban officials from doing that because it's wasteful. This is the organization the world is looking to for guidance as it battles a pandemic that could kill millions of people. Jeff Steyer is a senior fellow at the Taxpayer Protection Alliance. He's covered corruption at WHO for years. He joins us tonight. Jeff, thanks so much for coming on.
Good to be with you.
So how did this man, who seems not just unqualified, but seems to have the kind of background that would make him exactly the wrong person to run the World Health Organization, how did he get this job?
Well, that's right. Even though U.S. taxpayers cover about almost half the bill for the WHO, $2 billion a year WHO budget, we have very little say over what they do, and they have elections. Different countries have voted to support Mugabe. There's been corruption at the WHO before Mugabe, but people like myself were sounding the alarm bells to have a Marxist. And this guy was a number 3 official in a Marxist regime of Ethiopia. And as you pointed out, he went on to appoint Robert Mugabe, of all people, to be a goodwill ambassador. This is a culture of corruption at the WHO that goes beyond Tedros. It goes beyond the prior Director General. It's part of the culture. This was not, you pointed out, the $200 million a year they spend on first-class air travel and hotels. That's more than they spend on AIDS, tuberculosis, and other diseases combined, and there's no oversight. There was a criticism of that 5 years ago. The Associated Press did a report just in 2017 and found that it was happening again. And Dr. Tedros, his primary goal, is socialized healthcare all over the world. That's his goal. We need to have faith in our public health institutions. But right now, the World Health Organization needs oversight. It has shown us time and again it's not going to reform itself. And we, U.S. taxpayers who are funding this corruption, need to do a better job of putting in some oversight.
I mean, that's a shocking story. But it goes from annoying, kind of head-shaking, to really a peril to our country in the middle of a rising epidemic. So a guy who denied the existence, who tried to cover up the existence of an epidemic, is coordinating the world's response to this epidemic, a threatening one. Does this have implications? I mean,
it does. It does. Well, as you pointed out, he has been praising China. Dr. Tedros has been praising China for transparency. That's like Lance Armstrong crediting the Houston Astros for having good sportsmanship. It's totally absurd. Now, I have called for the U.S. to cut back funding for the WHO, and the president has put that in his budget. And now, people like the Mailman School of Public Health professor Chelsea Clinton are saying this potential outbreak is Trump's fault, right? We need oversight of the WHO. We need to reform it, but we need to do so. We need to give it money with strings attached because it's times like this that we need to have an institution that the public can trust. And the WHO doesn't deserve it, and they haven't earned it, and we shouldn't be funding it at the same levels.
So we're almost out of time, Jeff, but did you just say Chelsea Clinton is a public health professor?
At the Mailman School of Public Health at Columbia University. She had a piece on CNN.com just yesterday blaming this administration for not being prepared. The problem is
I thought she worked at a hedge fund or was a documentary filmmaker. I didn't know she even had a job. How did she wind up as a public health? I mean, how low are the standards?
Well, it is the Columbia School of Public Health here in Manhattan, so it's pretty troubling. And you know, she got her piece placed on CNN.com, so at least she has an outlet. But the WHO doesn't want to hear from its critics.
No, obviously not. But higher education in this country is a joke, and unfortunately, that can have really bad consequences. I hope we're not going to see them now. Jeff, great to see you. Thank you.
Good to see you, Tucker.